So first off, just to point out a couple of good things that are happening and people that are getting recognized here. We had 18 RNs who were recognized by D Magazine or a Great 100. Come on in. Nurses for excellence in nursing. We recently had a Joint Commission visit where our stroke center was approved as a comprehensive stroke center by Joint Commission. I'm getting a thumbs up from Lisa. That's a big deal, right, Lisa? Only 2 places in town have that. 2 in Dallas, 4 in the state of Texas. So, credit to all of our people in the ED, our stroke center, Lisa and her group. Also, not only Joint Commission, but the American Heart Association, American Stroke Association recognizing our stroke program for their performance on those stroke guidelines. And Grand Prairie recognized our work for their, what is called Get Fit Grand Prairie Partner of the Year, and that has to do with a lot of our population health work around providing health and nutrition information to the community. More recognition. So our procurement team was recognized by the Minority and Women-Owned Business Enterprises, rather by the DFW Minority Supplier Development Council for our MWBE work. And so basically what that group does is try to ensure that all of the work we do, we buy a lot of services, and we want to make sure that in addition to providing services here, we're a good community partner, and we are working with our community to try to raise everybody in the community. And part of that is partnering with local vendors to be able to help develop and grow those local small businesses. And so we were recognized by this group for our work around minority and women-owned business, inviting those groups, working with those groups to try to get more representation in the services that we procure. We were named a new member of the Save 10 Coalition, and that has to do with our efforts to encourage employees to participate in our supplemental retirement plan. We have a very good supplemental retirement plan, for those I'm seeing some heads nod. You put up 6%, Parkland matches 6%, that's generous in the business here, and so it's a good way to supplement retirement. So if you're not participating in that, take a look at it and see. Like I said, Parkland matches that first 6%, which a lot of places don't do. So it's a good benefit. And last I looked at this, there's high participation. I know because we had some questions about it, like in nursing, over half of nurses participate in this. So if you're not doing it, take a look at it and do it. And it works at all levels of the organization. And then our Parkland Academy was awarded a $180,000 grant from the Texas Women's Foundation for the Rise to Success program. And this is a program where we work with high school kids, give them skills to develop career paths in healthcare-related career paths, and then invite them in, incorporate them into our organization. And so you probably know people that have been through this program. We have a number of employees now who have been through Rise to Success. And as I tell people, you know, at this place, we have an opportunity to make an impact obviously in caring for a lot of people that need our services. But with over 10,000, between 10,000 and 11,000 employees, we also have an opportunity to make an impact in the development, career development for a number of people in this community. And so we want to not miss that opportunity. And so this is one of a number of programs that Parkland Academy does to identify people who have potential and can develop a career path through Parkland. And so recently got a significant grant to help support that work. Okay, just a couple more recognition that I wanted to point out. This was, I got this picture and email a couple of weeks ago, and it's hard to see what it is, but this is a picture from the bridge, so you see the names, and that's one of our physicians walking with somebody with a stick, somebody who's blind, and that's one of our physicians helping him. So this is the note I got. While I was in huddle from NPH to while I was walking from NPH to Old Parkland after huddle, I looked out to the sidewalk and I saw a blind man walking with another person, holding his hand and helping him down the sidewalk. As I looked closer, I noticed the other person was Dr. Carlos Gerard. I pulled out my phone to capture the moment. I was so pleased to see one of our physician leaders demonstrating true servant leadership and his commitment to Parkland's mission. And I thought, it's great that that this person saw that, recognized it, and shared it. And so I just wanted to share it with the group, and just a way of saying, we have an opportunity to make an impact in so many ways. And so certainly not planned, but somebody captured it, and I thought it's a great message to share with the rest of the group. And I have one more similar to that. And this one I'll read. It's an email I had. We will, not occasionally, pretty regularly, we'll get some emails from people that have had good experiences, bad experiences. Most of the ones, I don't think y'all filter this, so I just get the good ones, but most of them are good experiences that we get. And so I'm gonna read this one to you. I was at Anderson Clinic a week ago, exhausted and frustrated, having just learned there may be a possibility that I have another autoimmune condition. I approached the pharmacy window to drop off some pain medication for mail order. David Adams, in a very kind and gentle way, said, "Are you sure you want to wait that long for this medication? After all, you're in pain." I explained to him that in my experience, the pharmacy has always had very long wait, and my patience on this particular day was non-existent. So they were going the mail order route. Then it dawned on me that I had needed to get 9 vials of blood drawn and x-rays. He said, "Great, go do that, and the medication will be ready for you when you return." "Are you sure?" I said. He said, "Yes, I'm sure." Turns out it was a slow day. He was right, and boy, did I need that pain medication. I couldn't have slept without it. I wasn't in the right frame of mind that day. So exhausted and feeling defeated, I needed a little encouragement from David, more than he even knew. This little thing that he did made a huge impact on my quality of care, and he deserves to be commended for seeing past my medical record number that day and seeing me as a human being in need of a little more. So I thought, it's a small note from email from that person, but again, just probably didn't seem like a big deal to David that morning, but it made a huge impact on that person. And so just a way of reminding all of you that, we all interact with patients and families. And so when we have those opportunities, it may not seem like a big deal to us, but sometimes those little things are a big deal to a patient or family. And so I wanted to share that story, and also to recognize David for being such a thoughtful person. And that's pretty typical. I talked to Vivian in the pharmacy, and she tells me that's not unusual. It's pretty typical of David. So let's move on to some of the activity that we're focusing on these days. First, our strategic plan update. Remember, we have 3 organizational goals. Everybody shares these same 3 goals. They account for 20% of everyone's performance appraisal this year. The first one has to do with our patient satisfaction score, and the goal was to move that from 85.2 to 85.9. Sounds like not much movement, but when you talk to Lonnie, our statistician, he says that's significant improvement. These numbers don't move. They don't move in big chunks. It takes time to move them. And so this is what he calculated as being meaningful improvement over the course of the year. We are seeing improvement. Our average currently is 85.7, so we're not there yet. We've got a few more months in the year to finish that out. So that's our patient satisfaction score. We have a budget goal, and that is to finish the year 1% or more below on the good side of the budget. We're doing a good job with budget. Thank you to all of you, because everybody participates in this goal, obviously. We're having a good year in terms of efficiency, and right now we're over 3% below our target there. So that's 3% on the right side of the target. And then the last one was to achieve a 10% or more reduction in patient safety events related to 2 patient identifiers. So remember, that's one of our major quality goals that we're focusing on. That's 2 patient identifiers, reducing errors by identifying patients, 2 identifiers, every patient, every time. And so we want to keep that at the forefront of our brain. Right now, we're right at about target on that. So we want to see a reduction in events related to that. And we're, like I said, we're sort of right about at the target. So we need to finish strong over the past couple of months to hit that goal. And again, that's 20% of everybody's performance appraisal this year. What we like to do, and what our team has built into the budget for next year is an incentive across the entire organization. So these goals would actually, or similar goals, would be tied to a 2% incentive. So in addition to the 2% merit that we will build into the budget, we will build in a 2% incentive that will be tied to the goals that you could achieve or not achieve, depending on what our performance is. We're not through the budget process yet, but I'm hopeful that we'll be able to keep that part in the budget for us this coming year. Questions on that? Okay, we are in the 5th year of the 5-year corporate integrity agreement. So we've got to finish the year strong in this regard. So the end of May of 18 is the end of our 5-year. We have a report that will be released soon on our performance on year 4 and the things we have to work for on year 5. I'll show you a few of those in a minute. But as a major part of this, we've got to be able to demonstrate that the function that the quality review organization has been providing over the past 4 years, that we are able to assume those functions internally. And so you'll see a lot of activity in our quality department in this year around standing up an internal quality review organization. So things like mock surveys. We will expect a mock survey sometime soon. So that will be coming. We are in the window for Joint Commission full survey, so readiness should be at the top of everyone's mind. And areas to focus on: infection prevention, cleanliness. So on all of the units, if you see opportunities, we need to be thinking about this. Remember, it could be tomorrow, it could be next week, where our mock survey is here, and we are in the window for Joint Commission. I know Joint Commission is in town because they're surveying Zale right now, and I asked Lisa if that means they're coming across the street next, and she said absolutely not. But if you see them, point them back to Zale, right? Okay. Did I get that right, Lisa? Okay. But infection prevention, cleanliness, 2 patient identifier, every interaction, make sure we're doing 2 patient identifier, and then reporting safety concerns. You know the way to identify those and report, and then be up to speed on our life safety, how we respond to the various codes. So although we haven't been issued the year 4 report from the QRO, our quality review organization, we've seen the trends throughout the year and have seen draft reports now and know that these are going to be major areas of emphasis for year 5, the year that we're in. First, incorporate the quality review organization functions into our operations this year. We talked about that. So that's the organization that Dr. Rabaglia is leading now, and the infrastructure around that has got to be able to continue the oversight that we're getting from the external body today. Further integrate our inpatient and outpatient operations. The QRO has raised some concerns that we're developing silos, that our outpatient activity is not well integrated with our inpatient activities. I think that has been variably true over the years. There's a major effort in the past several years to try to do a better job of integrating those services. I can't help looking back and seeing Paula, much like we do in WISH, for the rest of the organization. And so, so you'll see that work, making sure nursing, on the outpatient side and the inpatient side, understand kind of that we're all the same nursing unit and we under the same leadership. Same thing for medical staff and for financial services and social work and all that, to make sure that those are fully integrated operations. Succession planning is another one. When we lose leaders, making sure we've got somebody ready and understanding the role to step in, and then a focus on HR improvements, particularly around total rewards, compensation, and the support that HR has for the organization as a whole. And so those will be major areas of focus in this year 5 of the CIA. You might remember a year or so ago, we began this Parkland Innovations Program. Basically, the idea is provide a forum for people to submit ideas on, particularly around how to improve the patient experience, improve outcomes, lower costs. The triple aim, how can we get better outcomes at lower costs? And so there's a venue to submit ideas. And I asked John Raish, whose group is managing this, to give me an update on some of the things that they have done throughout the past few months on this. One of the ideas was around a virtual work policy, how people can work from home. Obviously, this is a tricky area, right? But there are places where it may make sense rather than us looking for space and working on space. So out of necessity, for instance, right now, some of our foundation functions are happening remotely because we got kicked out of some lease space before with very short notice. And so while we're devising new space for them, it's helping us work through some of this policy. But basically, if there are functions, things like coding, for instance, where you don't necessarily have to be on site, but it may be more efficient. So someone suggested that, and we're doing some work around where that makes sense. Increasing the use of solidifiers in our suction canisters to reduce biohazard trash and reduce costs. Defaulting to high volume printers in using black and white. People may not realize this, but there's a substantial difference between a color print and a black and white print. And if you print something that's all black and white and there's a little piece of a green logo on the bottom, that's a color page, and that has a much higher cost to that page than the black and white. So defaulting to black and white. Again, across the entire enterprise for a year, you move from pennies a page to thousands of dollars in printing costs. So increasing prescription, the number of script refills that can be delivered through a single shipment to reduce costs, managing people that have multiple ED visits with community supports. You may have heard about the value-based care program, and this has been done through our COPCs, identifying a team that would include a social worker, nurse, and a provider to look at a subset of people that have very high ED utilization. We're talking about some people that have had 30 visits in the past month. And so we went to the COPCs to pilot this and looking at per COPC, the 3 to 5 highest utilizers, and then put these teams on them and have seen some dramatic results where people have gone from 30 ED visits in the past month to no ED visits. And oftentimes it's addressing things like social supports, housing, medication, and things that they weren't getting. Some pretty straightforward things, replacing surgical gloves with lower cost alternatives, making travel reimbursement available through online applications, and doing work with our Parkland Indigent program, our financial assistance program. The line that you would see in Old Parkland in the mornings, we have got to do something with that line, and so there's been work going on there. We will conquer that line. And there's really are things we can do to reduce the requirement that people come on site to do that, to simplify the eligibility process, using electronic applications to do that. And so there's an active project going on with that right now. Shifting gears, talk about the old campus and what the plan is in terms of property in the old campus. As you, I'm sure are aware, we're trying to sell the old campus. When we moved from the old site to this site, the time between planning this new facility and moving, in that time period, we outgrew a lot of our functions in the new space. And so even though we planned for growth, we grew during the building process, and now we have more activity than we can accommodate on this side of the street. So we still have a significant clinic presence in the old building. We still have significant administrative presence in the old building. And so what we're attempting to do right now is the property on the old side, the hospital, the old hospital, the clinics, Building B, across the street, Amelia Court, we are attempting to sell the entire parcel. And if we are successful there, and we are far along in discussions right now, the idea would be we would move those functions on the other side of the street to this side of the campus. In the interim, if you're in one of those places, we will have to lease that space back because we need some time to plan and develop. So two of the things we know we'll have to do, for instance, is we'll need to build clinic space on this side of the campus because we have real volume on the old side that we just can't disperse in the community. It's our specialty clinics, and so we'll have to build clinics and we'll have to build parking. And so we're actively pursuing those plans right now to place that on this side. And what we hope to do is, with the proceeds from a sale, be able to build out the space we need on this side of the street. It won't match up exactly. In fact, it won't come close in some areas, like the parking a parking garage is expensive. And they hate to spend millions of dollars on a parking garage when there's so many needs, but it's part of the reality. And so we have that planning going right now. Parking, clinic space, some admin space. And we hope to be able to make some announcements over the coming months about where we are on that. But right now, we're in some quiet discussions with people who are interested in buying the property. We've done some master facilities planning, looking at this side of the street. There's a lot of property, and so we want to make sure when we build the next thing that it doesn't cause us a problem from building, to our needs 10 years from now. And so we've had somebody come on site and look at all of our space, look at our needs, project our needs for the future, to look at how we would accommodate movement once we sell the old campus, where we would relocate functions to on this campus, looking at parking needs, and also in the community as well as where we need to grow our COPC and our outpatient services. This is a project that we've been discussing with our foundation now for a few years, and we've had some interested foundation members, interested in providing a better site service opportunities for our women with breast cancer and breast disease. Right now, as you know, we're in leased space on Maple Avenue. It's cramped space. We will do diagnostics there, and then women will have to come back onto the main campus for some of the interventions. It's inconvenient and it's cramped, and so I was approached by some of our foundation supporters who said, we want to support the building of a breast center to relocate those services onto campus. And so we've been studying that and looking at it. And now that we've got some clarity on what we need to do, what our overall needs are on this side of the street, we feel comfortable moving forward with this planning. And so what we're designing right now is 2 floors to be added to the ambulatory surgery center. And within those 2 floors will be our breast center services, plus some other clinical space that we're still determining programming on. We provide today breast services for more than 30,000 women a year, and it's in very cramped space. And so that will move onto campus. Will be diagnostics can happen in the building. Then if they need interventions, they're in the same, in the ASC. They can get all of that done in the same place. That project will be about a $40 million project, and our foundation has committed to raising the $40 million. And so this is one of those projects where, there certainly is a need. We have a lot of competing needs, obviously, but this is a need that comes with an energized constituency that wants to help us meet the need, and they are well on their way. We've already gotten about $6 million in commitments on this in a very short time period since we've said, let's go ahead. And the board has given us authority to break ground once we receive $10 million in commitments, in hard commitments. And so we expect that to happen soon. And so we've gone ahead and begun planning around that project. Quick comment on where we are in the budget planning for this year, 18. Thanks to a lot of the hard work of many people in this room, I showed you earlier, we're hitting our budget marks for the current year, and that will flow over into our planning for next year. Last year, during our budget process, we eliminated 300 positions, and that was not a fun experience to go through. Most of those positions were unfilled positions, but not all of them were. We have focused on not growing those positions back over the year. We've had a group of operations and HR kind of reviewing every request for a new position so that we don't just evolve back into that same position where we were last year and have to go through this cycle again. And so because of that discipline on positions, we are now still about, we're still below our FTE count from last year when we reduced these numbers, and that's making our budget planning process easier this year. So we are closer to meeting our budget goal at this point in planning than we've ever been. We're still not there yet, but we're close, and we're going through all the new initiatives and looking at the new requests to see how much of that we can accommodate. But kind of the gross description is we're not looking at cutting programs. We're not looking at cutting FTEs because of budget constraints. We are projecting anywhere from around 3 to 8% growth in activity. The 3% is kind of the norm. If you look at our clinic activity, our inpatient activity, the 8% is our deliveries, where we've seen significant growth in the past couple of years, and we're expecting that to continue to grow. And so on the delivery side, we're looking at about 8% growth, but for the most part, the rest of the organization, somewhere in the range of 3%. And as I said, we're looking at, we're not doing targeted reductions in FTEs. We're always looking to make sure we got the right number and we're running a tight operation. But we're benefiting from some of the tough work that was done last year in that regard. And obviously, where we have increased volume, we'll have to flex our staff to meet those volumes, because we want to make sure we maintain our ratios, particularly in those patient care areas. A couple of other information pieces. If you haven't seen the employee app, you can take a look at it. You'll get access to this presentation, so I won't read the instructions on how to get it. But you can get these various publications, Parkland Now, Parkland Later, some interesting numbers. My favorite app is the CEO Update app. You can always go there and see what Lauren has for me to say. But seriously, not a bad tool to have, to be able to have quick access to critical numbers, emergency information, code of conduct. So if you don't have it, take a look at it, and you can look at the presentation and see how to download it. And then if you've got ideas, you can imagine, it's got maps of the campus, but you can imagine other uses. And so if you've got good ideas on what we could add to that, you can get those to Lauren as well. And because this will be constantly evolving. We have begun transitioning to Microsoft Office 365. Matt Call tells me that this is a good thing. It's just sort of, he dumbs down his IT explanations for me. So he says this is a good thing that we're doing. It will save money, and it will make our applications constantly up to date. So it'll be done at an enterprise level, so that all of the updates will be done system-wide. If you're interacting with people, you'll be on the same version of the various programs. And you'll be notified when your migration date is coming up. Some of it has already begun, and it'll be going on through 2018. And then finally, a couple of slides on our employee engagement survey. These results, actually, tomorrow, we'll be doing a WebEx with the leaders and submitting a WebEx, a recorded message to the entire organization to share results of the employee engagement survey. What I can tell you this morning is we had a very strong response rate. 79% of people responded. So what that says is that regardless of what people's opinions were, people are engaged and feel that if you're giving your comments, if you're giving your opinions, hopefully you're feeling that those are going to be looked at. I can tell you, when we did the survey a year and a half or so ago, the information we got from that, some of the programs that we're doing now have grown out of the comments and the concerns that we heard. I know a lot more engagement going on around shared decision-making in areas, career ladders, so some of the PenCap work that's being done. We heard concerns from the survey 2 years ago about some of those issues. Career development, opportunities for development, Parkland Academy and others have been doing a lot of work in that area. And I can tell you that's showing up in the survey. People are recognizing that and appreciating that. So we had 79% of people participate. On the provider side, 51% of the hospital providers, 73% of our clinic providers. And what's next, the OTM business partners will be meeting with the vision leaders to look at the results and start action planning around those. So we'll have one objective each for employees, management, and executive leadership, because there are going to be things, let's say, just for instance, this is not one of the things, I don't think, but if pay is an issue, well, that's not something that general employees are going to be able to action plan around, because it may be out of their control, but it may be something that the executives can action plan around. And so what we're doing is we're looking at objectives that are appropriate and actionable for each category, that then those groups will be able to work on. And to simplify, it will be around three major objectives. I said three and I did four, and it's sort of there's something to that, because there are two kind of related issues that will be compressed into one of our objectives. And so to give you a bit of a preview, one of them is going to be around teamwork. We heard that concern that we need to do a better job with teamwork. Another one is around shared decision making, having input into decisions, and that one kind of is going to get merged in with this issue of respect, and I feel respected by the people I report to. And so the idea that if you feel like if people have input into how their operation runs, that input and sharing decisions and respect kind of go together. And so you'll see some objectives around that. But when you see the presentation, the results, it'll go into more detail around how we came up with those general objectives to begin focusing on. And so this is what will happen. Those objectives will be announced tomorrow. I just told you a couple of them. The employees and supervisors and managers will have action planning deadline of August 15th. September 1, the directors. September 15th, SVPs and VPs, executive chiefs, October. And then throughout the course of the year, we'll do some quick pulse surveys to see if people are aware of the action planning. So the idea is to simplify, have a few objectives to focus on, do action planning around those objectives at the unit level, and then be able to make sure that people are getting the message. We'll go in and ask questions along throughout the course of the year to make sure people are focusing on this. The message we want people to hear is, one, 79% of people responded. So it's important for us to be able to recognize that there's interest here. And so we want to be able to communicate back that we're paying attention. And so if units aren't aware of this action plan, we need to know about that. And so we'll be doing some pulse checks throughout the course of the year to see if people are aware of their action planning before we get into a survey the next time around. I can tell you, because we'll talk about this tomorrow, the general theme of this is going to be that we saw significant improvement from the last survey, but we're not where we need to be. We're not where we want to be. And so it will be sort of a mixed, it's going to be important to celebrate and recognize that we did see significant improvement. So when you talk to Press Ganey, who does the survey for us, they set a stretch goal for us last year and said, here's a number that if you exceed, we think that'll be tough to get to, and we exceeded our stretch goal. And that stretch goal represents what less than 25% of people that would improve in the Press Ganey survey would get to. And so it's significant compared to how people can improve there. So I think, and it's meaningful. It means that it's just not happening by chance. So we're seeing people feel more engaged right now, but we're not nearly where we want to be. When you see the numbers, you'll say, wow, don't celebrate too much because we still got work to do. But we can't miss the fact that there's been significant and meaningful improvement there. And why is that important? And I'll tell you, we'll talk a little bit about this again tomorrow when we do our WebEx, but I'll say this place, when you look at the work that happens here and the number of people that depend on this place for care and the meaningful impact people make. I told you a couple of stories, David in the pharmacy, you see Carlos, just simple acts that make an impact on people. This place does phenomenal work, and it makes an impact in the lives of people. And so for our employees, for you not to feel good about that and to be engaged and want to come to work and do this, we're not doing a good job as leaders if that's not the environment that you're working in. And so we want to understand if that's not the case, why that's not the case, and what we can do to make the environment such that people feel really good about coming to work every day. You know what I mean? And that's not where we've been. But what you'll see from this survey is people are feeling that that they're being heard. People feel improvement. but we still have work to do, and we want to kind of hear that input so that we can address the areas where people feel we're still falling short. And so you'll hear more about that over the next several days. Let me do a time check. I've gone a little bit longer than I wanted to. So that's the end for me. So why don't I just open it up and see what y'all want to talk about?
One question I had, you said you're selling the Parkland, the old Parkland, and you're going to incorporate that space in the new Parkland. Where is the surrounding space to do all of this?
How do we do that magic?
Yes.
So the question was, we sell the old place. How do we incorporate what's over there onto this side of the campus? Couple of what you'll see happening now that we've got some direction. And part of this, the delay has been working with potential buyers, seeing if we're going to sell the whole place, sell part of the place, and now that we have some direction, and that is what we hope to do is sell the whole place and move. We will start looking for parts in the old campus that we can empty. So we have some shelled space here. We've got some unused space on this side of campus, not a lot. But if there are areas where we can use that space, we'll start doing that work now. So on July 21st, John Raich will be meeting with people on the old side of the campus to start talking about this. There will be a process to follow to identify what could move early, and then things that we don't have a ready solution for, will stay on the old side even after a sale. We'll lease that space back so we can use the space while we build or identify areas that we can lease to move clinical and administrative space. So it'll be a process. It won't be immediate, but if there's some pockets here we can move people into, we'll do that. We hope to minimize double moves. We don't want to be moving here and then having to move out again. So we'll have some planning and a process around what makes sense. But it'll inevitably involve us leasing back space if we're able to sell soon and until we build some stuff.
Will that interfere with our budget?
It's, it all interferes with the budget. Because I wish I could say, we'll sell and be able to take those proceeds and build everything we need. But the fact of the matter is we won't. And so that'll be part of our calculus is, what can we afford to do? But no, it won't. We don't expect that to have an impact on our operational budget, if that's the question. We're not going to cut services so that we can, build a building. Okay? Yeah, good question. Yes?
Not to get you to commit to anything that might be rolling out July 3rd to the employees or to the staff, but anything being addressed to try to help with employee retention?
Retention. What area? Trauma. Yeah. Well. All right. So you guys have a new nurse leader over there. When we do
on the inpatient side, I do inpatient. I'm a provider, so even on the inpatient side, up on wards, it's equally as.
Yeah. When we look at so overall, when we look at our turnover, first off, it's a factor of our business. We're in a competitive business. Our turnover rate is about 18%, which is a couple of percentages higher than the market. Not way out of whack, but a little bit higher. On the nursing side, we're a little bit better than the market, but close. If you look at, it's very close. But our last numbers on nursing were about overall in the organization about 17.3%. Or 17.1%, I think, and our market is 17.3%. So on the organization as a whole, there surely are pockets that are better, pockets that are worse, right? And so when we look at HR has been doing a lot of work on exit surveys and trying to identify, why people leave. You could probably tell us why people leave, and oftentimes that has to do with it hasn't been until recently. It hasn't been a pay issue. That hasn't risen to the top. Now that's in the top 5, and so where we can address that, we need to address that to stay competitive. Other issues have had to do generally with leadership, your environment, and those are issues that kind of ongoing management issues that we need to focus on. So yeah, retention, it's a big issue because if you keep people longer, it's safer, it's more efficient. You know what I mean? You're not paying people, you're not having to induce people to come over and stuff. But what we've seen, so again, HR does this. There's a major effort going on with nursing right now to look at predicting, identifying why people are leaving and how you can, before those decisions happen, how you can intervene. Looking at is it the new hires, the intermediate, those 3 to 5 year people? Is it the older employees? So there's a lot of analytics going on right now in this space to try to identify, how we can predict why we're losing people and how to address it before it happens. So, if you guys have thoughts on that, we certainly want to hear that because obviously for us, the more stability you have, the better it is for the organization. Did you have a comment, an idea, thought? You do have something. You tell me after. All right.
You're trying to get her to whisper it to me because she knows I'll ask.
Yeah. You can talk, we have HR here too that wants to listen too. If you feel more comfortable with that. Yes.
On that note, I had some nurses go, but actually they're coming back. Does HR look at that, like the returning employees?
When you say look at that, like talk to.
Just the data, hey, these number of people left, but we're getting these returns. We're getting the percentage that are returning back.
Yeah. I can't tell you that. Can you?
I can give an apocryphal story. The new organization, our group does it. So I'm in there at least once a month, twice a month. And every single time we have new employee orientation, we have employees who came back. Now, as an example, the highest I ever saw was I did a group of 64 new employees, and there were 17 new employees who used to be employed at Parkland, left and came back. That's the highest I've ever seen. So every week there are employees that used to work here who are coming back. Every week.
This is it's a long-term play, right? It doesn't happen quickly, but I think some of the stuff you're seeing in nursing, for example, where there's been an investment in unit-based councils trying to get people to have input into their work. So what you hear from people is they want to feel like they've got input into their job. They want to feel respected. Certainly, pay is an issue, but oftentimes it is these other issues. So shared decision making, career ladders, opportunities for development. So when people can whether it's participating in a committee or getting additional accreditation, but having opportunities to develop and get some credit for that. So our career ladders, sharing and decision making. We're trying to create an environment where again people feel fulfilled at work and feel better about coming to work, and that's something that changes over time. It doesn't change immediately, but I think, and you guys tell me if I'm misreading that, but I do feel a little more positive energy around some of the work that's been going on, particularly in nursing around that. But like I said, if I'm misreading that, please, that's what this is all about for me to get that feedback.
Back is, she missed that teamwork. She didn't have it over there. It's been like 3 weeks she's been gone. So I see it.
Yeah.
Smile. So definitely areas to improve.
Can I add one other thing there?
From an employee relations standpoint, we have just in this year, early in January, introduced the shared services portal for any employee to call up, ask a question, put in any concerns that you may be having. One of the things that Dr. Cerise mentioned was the added efforts to collect the analytics from the people that are leaving. But we really understand that we need to start before that. We need to understand before you make that decision to leave that we really want to know what is making you look and search for that job. So very good question. We want you to be able to feel comfortable coming to our portal to ask questions utilize the chief's email address to be able to ask those questions, to let them know that there is a concern that is making you want to leave. That way somebody can come and talk to you directly about that. That's a big thing. Stay interview, things like that, trying to engage leadership and develop leaders to have open conversations with their employees about not just what we have to do, but why we have to do it this way. Those are big things. So hope that helps you too.
Thank you. Yep, it does. Yes.
It sounds like the Simmons Center project will happen probably very quickly. Will part of that be something to address the increased volume of parking that's going to be required? Because there's really not much parking over there, and we're already almost like maxed out. I mean, if I don't come to work 30 or 40 minutes early, then I might as well go park in Kroger. And that's right now without bringing 30,000 more patients to the top 2 floors of the Simmons Center.
Yeah, you're at the ASC now?
No, I'm here.
Yep.
But I'm just saying,
Yeah.
where are you going to, what's the plan for parking?
Yeah, so there'll be additional parking at the ASC. Oh, sorry. So the question was about parking and using the ASC as one example, bringing more people on campus. So 2 parts to the answer. One, for the ASC activity itself, there'll be additional parking that is planned with the ASC addition. And then in general, again, if we are successful in selling, which we think we will be, we'll lease back the current parking that we have in the ER garage until we build out additional parking on this side of the street. And there's another garage on this side of the street that's in the works. But again, that's, it's not an immediate solution. We do have a surface lot that will be coming online, and I'm not sure, Paula, do you know, that's still a number of months away, but back over by the utility plant, it's not going to be, the fix for the parking problem, but it'll be, space that we do have available that we will be using for that too. If we did something, somebody at one of the other sessions said, if you did a supplement with the DART line, people wouldn't drive on campus and more people would take the DART. Just a sense. I mean, do people feel like that's realistic, or you feel like we need it?
Well, they don't keep their times. They're posted on the signs that service the lot. You have to be here on time.
Mm-hmm.
So I don't think.
I'm getting a no from that one. Yeah.
I mean,
to count on it, I kind of agree. I mean, we can't count on.
Use the bus,
Yeah.
but I mean, they don't circulate the way they're supposed to now,
Mm-hmm.
and so.
I think it has to do with the level of employees and where they are in terms of, their job grade or whatever. The lower paying employees, they do ride the bus. And I think if you would incentivize them in some way, that more of them would ride it, and then they wouldn't be utilizing the parking space.
Yeah.
People live out in the suburbs and whatever. It's not, and there's not always a lot of bus services in those areas.
Mm-hmm.
So inner city, yes, they do.
Okay. Thanks. Yes. So the question, did we hear the question? It was, do we have anything planned around food services for night shift?
Yeah.
And so I'm hearing that. I can tell you that's not something that I'm aware that we have something in the works for, but
You sort of feel like you're the black sheep of the family if you work night shift, and you need night shift people, and you need weekend and holiday people, but there's nowhere to go to get food unless y'all provide it, or you bring it from home, and you sort of feel like you're undervalued. Those are kind of your most valuable people, because they're the hospital's still full of people even when the 9 to 5 people aren't here,
right.
So they're not, you can't buy a hamburger and you can't go anywhere to get a hamburger.
I hear you.
Well,
Okay.
even back in the day, McDonald's, it was was always, at least you knew, as long as it wasn't 3 o'clock in the morning when they closed for that 1 hour, you knew if you could just get there before 3 o'clock, you could still get a cheeseburger and ice cream.
Yes,
If they had to turn the machine off for a Coke, and that's been,
And the market's
Missing.
open a lot, but the market's also understocked. I mean, like, you go in there and it's empty, there's not anything.
Okay.
It's closed on the weekends.
Yeah, and that,
All right, so I'm hearing nights and weekends. Okay.
holidays.
That's for a family. So what if they want a snack, they want something? We encounter that across the street a lot. At least this week we were over there and family were like, they get something to eat. Like, what is it? You put your children across the street. Well, that's too far away.
Mm-hmm.
We're not.
Okay. All right. Thanks for that. And we're getting people that are recording, and so this will all go into some follow-up discussion that we have to identify themes that we can address. So
I
thanks.
think that food issue alone is a big, like, something that would help with retention. I mean, I think that if those employees, and I mean, not just employees, the patients and their family members too, but
Mm-hmm.
you're looking at retaining experienced nursing and staff, they feel less valued because clearly their dietary needs aren't
Right.
as important
Right.
as daytime people's.
Right. Okay. Anything else? Yes.
What if they take, you guys did your employee week? I thought that was great.
Oh yeah, that was fun. Thank you for that.
Great, we love that.
So there was an employee group that put that together, as you probably know, and that group did a phenomenal job. I thought it would. So thanks for mentioning that. Yeah. Yep.
Years ago, we did have a tool, tool available to us where we could go in and see pay grades, pay scales, and things like that. That has not been available to us for some years. So when you talk about, moving to other positions, doing other things, you don't know where you are, and so it could be you may be doing for a promotion or it may be a lateral move. And you just don't want to waste your time and then the person's time interviewing you to find out that you're going to be at the same level or maybe even below where you are. And plus, it's good to know where you are in your current position. Is there any? Do we have any knowledge whether that tool will become available?
I'm gonna defer to some of my HR friends. Okay. Paul, you wanna?
So there's a big initiative around all the job codes. We have, I'll exaggerate, 1 million job codes. It's not that bad, but so we're looking at the whole career pathing throughout Parkland and all the job codes so that they're more realistic and condensed and clear for you all, so you know how you can move from one level to another. So as that work is happening, then they're doing the market analysis. Okay, what are the job pay ranges for those new job codes? So as those are being done, then that will be released. But if you have immediate questions, you can connect with your OTM business partner, and that individual can find some information and provide that for you as well.
I think we're almost out of time.
All right.
for next week. So if anybody has any additional questions, you're more than welcome to come back and ask us, and we can scribe and get you to the right person and get some answers for you.
Okay. Thanks, Lauren, and thanks everyone.
Thank you.